scientists all around the world are racing to understand more about that latest COVID variant we've been talking about, dubbed Omicron. It's sparked international travel bans already. This after on Friday, the World Health Organization classified it as a variant of concern. This amid fears it could be potentially more transmissible and more able to evade immune protection. To talk about that, our health editor Julia Seeger is with me in the studio. And Julia, let's start first of all with the basics. What is it that we know about this new variant?
Well, as you said, we don't know much for sure, at least. Science actually takes time. You need to collect the data. You need to analyze it. The WHO says it's going to take at least 2 to 3 weeks to actually know a little bit more about its transmissibility, but also whether it's more deadly. Now, what we do know is that it was actually first identified in South Africa a couple of days ago. Its scientific name is B11529, and it has now also been identified in dozens of other countries. It's been classified as a variant of concern, and this is actually based on concerning mutations. We'll go back on that in just a few minutes, but I think it's important to say that at this point, we don't know much indeed about whether it's more contagious or deadly. South African authorities are being quite reassuring. Angelique Cortis, she's actually the first doctor in South Africa to have alerted on this variant, and she says that she actually observed more mild symptoms, at least on a younger population, on young adults. They often describe intense fatigue as being the main symptom. Now, we'll have to see, of course, about how other age categories react to Omicron. Now, preliminary evidence does suggest, though, that there's an increased chance of reinfection. So people who've had COVID-19 in the past have a higher chance of being reinfected more easily with Omicron. And of particular concern is perhaps the fact that there is a huge number of genetic mutations on this variant, including 30 that are specifically located on the spike protein. So this is actually what is alerting scientists today. But that said, it doesn't mean we don't know. It means new characteristics, but we don't know how it's actually going to change the behavior.
Another really key question that many people are asking, Julia, is about the vaccines. How well do they work when it comes to Omicron?
Well, it's actually all linked to the mutations on the spike protein. As you know, the spike protein is actually what the virus is going to use to enter a human cell. And all of the vaccines that we have against COVID-19 have actually targeted specifically the spike protein. So the more changes you have on the spike protein, of course, the less effective a vaccine will be. Now, the number of people testing positive in certain provinces in South Africa is on the rise, but we can't link it, at least today, to Omicron directly. Now, the CEO of Moderna, Stéphane Bancel, has said that he thinks that there's going to be a need for an all-new vaccine because the Omicron variant that we're seeing, in his opinion, is way different than the Wuhan strain that we first used to develop in the first place those vaccines.
So how long would it take to get a new vaccine or indeed to adjust the ones that we already have?
Well, Pfizer and BioNTech have said that they've actually been working on this, on the event that, there could be a resistant strain. And they say that they could actually reformulate a vaccine in 6 weeks with the first doses being rolled out in the first 100 days. I mean, that's... we've never actually seen that before. And some competitors are actually saying that this is almost impossible because we would have to try to see how antibodies react. Now, Moderna is being a little bit more cautious. It says that within 60 to 90 days, it will be able to reformulate, but that's before the testing phase.
Now, South Africa has been pointing out, we've been hearing from the President Cyril Ramaphosa talking about vaccine disparities around the world and the potential links that might have with the emergence of this new variant in South Africa. Can you explain what he's talking about here?
Well, actually, since the start of this pandemic, we've been told that, mass vaccination is the absolute only way out of this pandemic. But that's only true if there aren't any resistant variants that come into play, of course. So we have to take that into consideration. Now, the thing is, the risk of seeing a new resistant strain emerge is at its height when you have a high proportion of a population that is vaccinated, but not enough to actually get to herd immunity. So as the number of vaccinated people increases within a population, the more the competitive advantage of vaccine-resistant strain increases as well. Now, it's estimated that the chances of seeing a new variant emerge is when you have about 60% of a population that is vaccinated. And that's actually the rates of vaccination that we're seeing all in developed country as well. So it's not just about developing countries. that's actually on a national level. If you look on a global level, 40% of the world population today is vaccinated. So here too, it's going to create a situation in which it's going to favor the emergence of variants. Now, there is a question we need to ask ourselves. It's whether we should indeed, as the WHO is suggesting, we should vaccinate the entire world. Will we have time to actually roll out those vaccines? Will those vaccines work? Or do we have time to roll them out before the emergence of other resistant strains? So those are really important questions. And some specialists are saying that this all vaccine strategy is perhaps not the most effective, and we should consider maybe going towards a more diverse strategy against COVID-19.
All right, really interesting stuff. Thank you very much indeed, Julia Seeger, for breaking down that really important story for us today. Our health editor, Julia Seeger, for us.